Hello dear students, in this session let's focus on health and nutrition as an indicator of inequality. So this is the third one. First one sex ratio, second one education, and this is the third one, that is health and nutrition as an indicator of inequality. Why health is important? See, being healthy should be a part of your overall lifestyle. Living a healthy lifestyle can help in preventing chronic diseases and long-term illness. Feeling good about yourself and taking care of your health are important for your self-esteem and self-image. And even maintaining a healthy lifestyle by doing what is right for your body is also very important, which comes under health. Okay, so first let us know the basic concepts of health. The word health refers to a state of complete emotional and physical well-being. Health can be defined as physical, mental and social well-being, and as a resource for living a full life. Full life. It refers not only to the absence of disease but the ability to recover and bounce back from illness and other problems. ಅಂದರೆ ಆರೋಗ್ಯ ಎನ್ನುವಂಥದ್ದು ಸಂಪೂರ್ಣವಾದ ಭಾವಾತ್ಮಕ ಮತ್ತು ದೈಹಿಕ ಯೋಗಕ್ಷೇಮದ ಸ್ಥಿತಿಯನ್ನು ಸೂಚಿಸುತ್ತದೆ. ಆರೋಗ್ಯವನ್ನು ನಾವು ದೈಹಿಕ, ಮಾನಸಿಕ ಮತ್ತು ಸಾಮಾಜಿಕ ಯೋಗಕ್ಷೇಮ ಮತ್ತು ಪೂರ್ಣ ಜೀವನವನ್ನು ನಡೆಸುವ ಸಂಪನ್ಮೂಲ ಎಂದು ವ್ಯಾಖ್ಯಾನಿಸಬಹುದು. ಇದು ಅನುಪಸ್ಥಿತಿಯನ್ನು ಮಾತ್ರವಲ್ಲ, ಕಾಯಿಲೆ ಅಷ್ಟೇ ಅಲ್ಲದೆ ಅನಾರೋಗ್ಯ ಮತ್ತು ಇತರ ಸಮಸ್ಯೆಗಳಿಂದ ಚೇತರಿಸಿಕೊಳ್ಳುವ ಸಾಮರ್ಥ್ಯವನ್ನು ಸಹ ಸೂಚಿಸುತ್ತವೆ. ಯಾವುದು? ಆರೋಗ್ಯ ಎನ್ನುವಂಥದ್ದು. ಈಗ ಇನ್ನು ದೈಹಿಕ ಆರೋಗ್ಯ. ಇನ್ ಅ ಪರ್ಸನ್ ಹೂ ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್ ಫಿಸಿಕಲ್ ಹೆಲ್ತ್, ಬಾಡಿಲಿ ಫಂಕ್ಷನ್ಸ್ ಆರ್ ವರ್ಕಿಂಗ್ ಎಟ್ ಪೀಕ್ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಡ್ಯೂ not only to a lack of disease but also a regular exercise, balanced nutrition and adequate rest. ಅಂದರೆ ದೈಹಿಕ ಆರೋಗ್ಯವನ್ನು ಅನುಭವಿಸುವ ವ್ಯಕ್ತಿಯಲ್ಲಿ ದೈಹಿಕ ಕಾರ್ಯಗಳ ಗರಿಷ್ಠ ಕಾರ್ಯಕ್ಷಮತೆಯಲ್ಲಿ ಕಾರ್ಯನಿರ್ವಹಿಸುವಂಥದ್ದು ಮತ್ತು ಇದು ರೋಗದ ಕೊರತೆಯಿಂದ ಮಾತ್ರವಲ್ಲ, ನಿಯಮಿತ ವ್ಯಾಯಾಮ, ಸಮತೋಲಿತ ಪೋಷಣೆ ಮತ್ತು ಸಾಕಷ್ಟು ವಿಶ್ರಾಂತಿಗೆ ಕಾರಣವಾಗಿರುವಂಥದ್ದು. ಯಾವುದು? ದ ಪರ್ಸನ್ ಹೂ experiences physical health. Now let's understand the meaning of health and nutrition. First one, let's focus on the meaning of health. Health in general refers to a bodily health or sound bodily condition free from physical and mental diseases. ಆರೋಗ್ಯ ಎನ್ನುವಂಥದ್ದು ಸಾಮಾನ್ಯವಾಗಿ ದೈಹಿಕ ಮತ್ತು ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳಿಂದ ಮುಕ್ತವಾದ ದೈಹಿಕ ಆರೋಗ್ಯ ಅಥವಾ ಉತ್ತಮ ದೈಹಿಕ ಸ್ಥಿತಿಯನ್ನು ಸೂಚಿಸುತ್ತದೆ. The word nutrition refers to the habit of consuming energizing food that is helpful in keeping bodily organs in a healthy condition. ಪೌಷ್ಟಿಕಾಂಶ ಎನ್ನುವಂಥದ್ದು, ಪೌಷ್ಟಿಕಾಂಶ ಎಂಬ ಪದ ದೈಹಿಕ ಅಂಗಗಳನ್ನು ಆರೋಗ್ಯಕರ ಸ್ಥಿತಿಯಲ್ಲಿಡಲು ಸಹಾಯ ಮಾಡುವಂಥದ್ದನ್ನು ಸೂಚಿಸುತ್ತದೆ ಮತ್ತು ಶಕ್ತಿಯುತ ಆಹಾರವನ್ನು ಸೇವಿಸುವ ಅಭ್ಯಾಸವನ್ನು ಸಹ ನಾವು ನ್ಯೂಟ್ರಿಷನಲ್ಲಿ ತಿಳಿದುಕೊಳ್ಳಬಹುದು. ಓಕೆ, so this general health condition of women is one of the social indicator of women's status. ಅಂದರೆ ಮಹಿಳೆಯ ಆರೋಗ್ಯ ಸ್ಥಿತಿ ಏನಿದೆಯೋ ಅದು ಮಹಿಳೆಯ ಒಂದು ಸ್ಥಿತಿಯನ್ನು ಸಮಾಜದಲ್ಲಿ ಮಹಿಳೆಯ ಒಂದು ಸಾಮಾಜಿಕ ಸೂಚಕವಾಗಿ ತಿಳಿದುಕೊಳ್ಳುವಲ್ಲಿ ಸಹಾಯ ಮಾಡುತ್ತದೆ. ಮಹಿಳೆಯ ಆರೋಗ್ಯ ಸ್ಥಿತಿ ಸಮಾಜದಲ್ಲಿ ಮಹಿಳೆಯ ಸಾಮಾಜಿಕ ಸೂಚಕವಾಗಿ ಇದು ಹೆಲ್ತ್ ತಿಳಿಸಿಕೊಡುತ್ತವೆ. ಓಕೆ, ಸೊ ಜನರಲ್ ಹೆಲ್ತ್ ಕಂಡೀಷನ್ ಆಫ್ ವುಮೆನ್ ಈಸ್ ಒನ್ ಆಫ್ ದ ಸೋಷಲ್ ಇಂಡಿಕೇಟರ್. ಮಹಿಳೆಯ ಆರೋಗ್ಯ ಸ್ಥಿತಿಯು ಸಾಮಾಜಿಕ ಸೂಚಕವಾಗಿ ಸಮಾಜದಲ್ಲಿ ಮಹಿಳೆಯ ಸ್ಥಾನಮಾನವನ್ನು ಸೂಚಿಸುತ್ತದೆ. ಅದು ಮಹಿಳೆ ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಯಾವ ರೀತಿಯ ಸಮಾನತೆಯನ್ನು ಅಥವಾ ಯಾವ ರೀತಿಯ ಅಸಮಾನತೆಯನ್ನು ಹೊಂದಿದ್ದಾಳೆ ಎಂಬುದನ್ನು ಸೂಚಿಸುತ್ತದೆ. ಓಕೆ, ಸೊ ದ ಡೈಮೆನ್ಷನ್ಸ್ ಆಫ್ ವುಮೆನ್ಸ್ ಹೆಲ್ತ್ ಆರ್ ಮೆನಿ ಸಚ್ ಆಸ್ ಸೆಕ್ಸ್ ರೇಷಿಯೋ, ಫರ್ಟಿಲಿಟಿ ಲೆವೆಲ್ ಆ್ಯಂಡ್ ಮೊಟಾಲಿಟಿ ರೇಟ್ಸ್, ನ್ಯೂಟ್ರಿಷನಲ್ ಸ್ಟೇಟಸ್ ಎಕ್ಸೆಟ್ರಾ. ಅಂದರೆ ಮಹಿಳೆಯ ಒಂದು ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಆಯಾಮಗಳನ್ನು ಸೂಚಿಸುವುದಾದರೆ, ಆಯಾಮಗಳನ್ನು ನಾವು ನೋಡಬಹುದಾದರೆ ಅದು ನಮ್ಮ ಲಿಂಗಾನುಪಾತ, ಯಾವುದು ಲಿಂಗಾನುಪಾತ, ಫರ್ಟಿಲಿಟಿ ಲೆವೆಲ್, ಮೊಟಾಲಿಟಿ ರೇಟ್ಸ್, ನ್ಯೂಟ್ರಿಷನಲ್ ಸ್ಟೇಟಸ್ಗೆ ಅವಲಂಬಿತವಾಗಿ ಅಥವಾ ಅವುಗಳ ಆಧಾರದ ಮೇಲೆ ಯಾವ ರೀತಿ ಮಹಿಳೆಯ ಒಂದು ಆರೋಗ್ಯದ ಸ್ಥಿತಿಯನ್ನು ನಾವು ಅಸಮಾನತೆಯ ಒಂದು ಇಂಡಿಕೇಟರ್ ಆಗಿ ತೆಗೆದುಕೊಳ್ಳಬಹುದು ಎಂಬುದನ್ನು ಸೂಚಿಸುತ್ತದೆ. ಸೊ ನಾವು ಹೆಲ್ತ್ ಮತ್ತು ನ್ಯೂಟ್ರಿಷನನ್ನು ಅಧ್ಯಯನ ಮಾಡೋದ್ರಿಂದ ಅಥವಾ ಅವುಗಳನ್ನು ತಿಳಿದುಕೊಳ್ಳುವುದರಿಂದ ಮಹಿಳೆ ಈ ಎಲ್ಲ ವಿಚಾರಗಳಲ್ಲಿ ಯಾವ ರೀತಿಯಾಗಿ ಒಂದು ಅಸಮಾನತೆಯನ್ನು ಹೊಂದಿದ್ದಾಳೆ ಎಂಬುದನ್ನು ನಾವು ಈ ಒಂದು ಟಾಪಿಕ್ನ ಮುಖಾಂತರ ತಿಳಿದುಕೊಳ್ಳುವ. ಓಕೆ, ಸೊ ವುಮೆನ್ಸ್ ಹೆಲ್ತ್ ಸ್ಟೇಟಸ್ ಇನ್ ಇಂಡಿಯಾ is extremely poor. So it is referred as, that is why it is referred as, in general health condition, women is one of the social indicators of the women's status. Andre women's health status in India is extremely poor because she's not this refers to the fact that sometimes she's not getting the good medical health facilities, or she's not even considered to be a part of a healthy life. Okay, so that is why it is said that women's health status in India is extremely poor. Women in India are in a disadvantageous position as far as the availing health services are concerned. Due to male preferences, women's health is usually neglected. ಈಗ ಮೇಲ್ ಪ್ರೆಫರೆನ್ಸ್ ಎನ್ನುವಂಥದ್ದು ಹೆಚ್ಚಾಗಿರುವುದರಿಂದ ಈ ಮಹಿಳೆಯ ಒಂದು ಆರೋಗ್ಯ ಏನಿದೆಯೋ ಅದು ಮಹಿಳೆಯ ಆರೋಗ್ಯವನ್ನು ಕಂಪ್ಲೀಟಾಗಿ ಅಥವಾ ಯೂಶ್ವಲಿ ನೆಗ್ಲೆಕ್ಟೆಡ್ ಆಗಿ ಪರಿಗಣಿಸುವಂಥದ್ದು. ಇದು ಸಮಾಜದಲ್ಲಿ ಮಹಿಳೆಯರು ಆರ್ಥಿಕವಾಗಿ ಯಾವ ರೀತಿಯ ಅಸಮಾನತೆಯನ್ನು ಎದುರಿಸುತ್ತಿದ್ದಾರೆ ಎಂಬುದನ್ನು ತಿಳಿಯಲು ಅನುವು ಮಾಡಿಕೊಡುತ್ತೇವೆ. ಆ್ಯಂಡ್ ದೇ ಆರ್ ನಾಟ್ ಸಪ್ಲೈಡ್ ವಿತ್ ದ ಮಿನಿಮಮ್ ರಿಕ್ವೈರ್ಡ್ ನ್ಯೂಟ್ರಿಷಿಯಸ್ food. Okay, so some indicators of health and nutrition condition of women. The following health indicators reveal to what extent health and nutrition of Indian women are neglected. ಯಾವೆಲ್ಲ ಏರಿಯಾಗಳಲ್ಲಿ ಮಹಿಳೆಯರ ಒಂದು ಆರೋಗ್ಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಯಾವೆಲ್ಲ ಏರಿಯಾಗಳಲ್ಲಿ ಇವರ ಒಂದು ಹೆಲ್ತ್ಗೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಯಾವೆಲ್ಲ ಏರಿಯಾಗಳಲ್ಲಿ ಇವರ ಒಂದು ಆರೋಗ್ಯದ ಪರಿಸ್ಥಿತಿಯನ್ನು ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಲಾಗಿದೆ. ದ ಫಸ್ಟ್ ಒನ್, ದ ಆವ್ರೇಜ್ ಲೈಫ್ ಎಕ್ಸ್ಪೆಕ್ಟೆನ್ಸಿ ಆಫ್ ವುಮೆನ್ ಅಟ್ ಬರ್ತ್ ಇನ್ ಇಂಡಿಯಾ ಈಸ್ ಲೆಸ್ ದ್ಯಾನ್ ದ್ಯಾಟ್ ಆಫ್ ಡೆವಲಪಿಂಗ್ ಆ್ಯಂಡ್ ಡೆವಲಪ್ಡ್ countries. Okay, the average life expectancy of women at birth in India is less than that of developing and developed countries. The next one, infant mortality rate IMR per 1000 live births is 73 in India, whereas it is only 17 in Sri Lanka and 66 in the developing world, and the world average is only 60. And third one, maternal mortality rate MMR per 1 lakh live births is 570 in India, whereas it is only 140 in Sri Lanka, 470 in the developing world, and its world average is 430. The fourth one, of the babies that are born in India, 33% are underweight babies, whereas it is only 17% at level of developing countries and at the whole world level. And fifth one, as far as the use of contraceptives are concerned, only 44% of the Indians are using them, whereas the percentage stands at 66 for Sri Lanka and 54 for the developing world. These are the indicators of health and nutrition condition of women. Sixth one, on the average per day, women in India consume food that is about 1000 calories less than what men consume. And seventh one, more than 40 to 50% women in urban areas and 50 to 70% in rural areas are suffering from anemia due to the shortage of nutritious food. Eighth one, number of women who seek public medical help is only 1 per per 3 of the number of men who avail of the health services. Ninth one, majority of women's health is further harmed by air and water pollution and lack of sanitation. Even inside the house also, women while cooking are exposed to smoke coming out of biomass and kerosene stoves, which impairs their health very badly. 10th one, a large number of women are becoming the victims of HIV or AIDS and other sexually transmitted diseases. Okay, these are the indicators of health and nutritious condition of women. What the problems in these points, what are the problems that women are facing, what are the health problems that women are facing, and what are the facilities, if it is there also, like why they are not able to get those facilities, those are mentioned in these points. Okay, so the next one is IMR, MMR and TFR. Okay, first one IMR, that is infant mortality rate. It means it refers to the number of the deaths among infants under 1 year of age for 1000 live births in a given year. Infant mortality rate refers to the number of deaths among infants under 1 year of age for 1000 live births in a given year. Next one, maternal mortality rate. First one, infant mortality rate. Shishu Marana Pramana. Shishu Marana Pramana refers to the number of deaths. Shishugala Marana yaudu 1 year age ಒಳಗೆ 1000 birth in a given year. Next one, maternal mortality rate MMR refers to the total number of mother for 1000 live births in a given year in a country's population. ತಾಯಿಯ ಮರಣ ಪ್ರಮಾಣ. ಓಕೆ, ಡೆಲಿವರಿ ಟೈಮಲ್ಲಿ ಆಗುವಂತಹ ತಾಯಿಯ ಮರಣ ಪ್ರಮಾಣ ಅದು ವರ್ಷಕ್ಕೆ 1000 ಲೈವ್ಸ್ ಬರ್ತಿಗೆ ಅನುಗುಣವಾಗಿ. And the third one, total fertility rate for India refers to the average number of children that would be born to a woman between the reproductive ages of 15 to 49 years. Okay, yeah, infant mortality and maternal mortality represent two sensitive indicators of human development. Unfortunately, in India, the incidence of both are comparatively high. So, in India, what is happening means the infant mortality rate as well as maternal mortality rate are the two sensitive indicators of human development, which is both comparatively high in India. India's maternal mortality rates are among the world's highest. So compared to other nations, India's is the highest. We have in India we have highest maternal mortality rates. So from a global perspective, India accounts for 19% of all live births and 27% of all maternal deaths that take place at the world level. Next, we have causes for, what are the causes for the relative high MMR? That means relative high maternal mortality rate. What are the causes? ಕಾರಣಗಳು ಯಾವುವು? ಈ ತಾಯಿಯ ಮರಣ ಪ್ರಮಾಣಕ್ಕೆ ಇರುವಂತಹ ಕಾರಣಗಳು ಯಾವುದು? Reluctance to seek medical care for pregnancy is one of the strongest reason for high MMR in India. Many women consider it as a temporary phase which will disappear on its own and hence do not seek medical help. Nationwide study revealed that only 40 to 50% of women receive any antenatal care. A woman who has already faced difficulties in the first or previous pregnancies is not seeking hospital service but usually treated with the remedies for 3 reasons. 1. She has to obtain the permission of the mother-in-law and husband for the same. Second one, financial consideration. And the third one, fear that the treatment may be more harmful than the malady. Okay. And next we have fertility factor, total fertility rate. Unregulated or uncontrolled fertility is a factor which is closely related to maternal mortality. In previous slide we have the causes for maternal mortality rate. In this we have other health. In this we have total fertility rate. Okay, so unregulated or uncontrolled fertility is a factor which is closely related to maternal mortality. Unregulated or uncontrolled fertility is a factor which is closely related to maternal mortality. The total fertility rate is one of the most useful indicators of fertility because it gives the best picture of how many children women are currently having. Okay, how many children women are currently having. Though the average TFR, that is total fertility rate of India, is 3.2, it reflects that certain hidden variations. Now let's move on to understand the causes of unregulated fertility are many, such as first one we have early age at marriage, low education, conformity to feminine gender roles, lack of knowledge coupled with the fear towards using contraceptives, intense craze for male child, and lack of entertainment facilities in the rural areas, and so on. So the next we are studying is like the causes of unregulated fertility are many, as such as first one early age at marriage, low education, conformity to feminine gender roles, lack of knowledge coupled with the fear towards using contraceptives, and intense craze for male child, lack of entertainment facilities. Okay, so these are the simple sentences you will understand by reading them only. And second, and in this slide we have given other health hazards of Indian women. So here it is given the causes of unregulated fertility are such as early age at marriage, low education, conformity to feminine gender roles, lack of knowledge coupled with the fear of towards using contraceptives, intense craze of male child, lack of entertainment facilities in the rural areas, and so on. Next is what are the other health hazards of Indian women. First one, medical surveys and statistics indicate that a large number of Indian women suffers from anemia, which contributes to premature birth, low weight at birth, and high prenatal mortality. See, WTO reports that anemia is caused behind at least 20% of all maternal deaths. And second one, the incidence of cancer of cervix amongst Indian women is said to be the highest in the world. Okay, incidence of cancer of cervix amongst Indian women is the highest one, to be the highest in the world. That means it is highest in India. Next, post tubectomy syndrome, menstrual bleeding disorders, and reproductive tract infection, etc. Do not receive. It is because of we do not receive proper medical attention in time, either due to ignorance or shyness, or because of shyness. All these may lead to anemia. And next one, no existing legislation of India protects the sexual and reproductive rights of women. According to some official estimates, per every year, as many as 5 to 6 million unsafe pregnancy terminations are taking place. So these terminations may adversely affect the health condition of women. So these are the other health hazards. Like, what are the other health hazards that are faced by Indian women? Especially in India, it is the highest in rate. And what are the reasons that it is highest in India? These are given in the following points. And next, another major public health threat to India, and particularly to women, Indian women, is the spread of AIDS, acquired immunodeficiency syndrome. Okay, another major public health threat to India and particularly to Indian women is spread of AIDS. A large number of women sex workers of India are affected by this. Though men mainly transmit HIV virus, that is human immunodeficiency virus, to women, ultimately it will affect women and their children become the victims of that, and they suffer. And the next one, women particularly working in the unorganized sector are made to work for a longer hours, which may lead to back pain and often even to miscarriages during pregnancy. And further, these women do not get maternity benefits, for example maternity leave, and also what are the necessary benefits will also they will not get in unrecognized sectors. So this will result of, which they, which affect their health, and that of their even baby will also suffer. Okay, so these are the other health hazards of Indian women. Okay, these are the health issues and these are the health problems that women are facing in India, and for why they are facing, and what are the diseases they are having in their health. So this is about health and nutrition as the indicator of inequality. Okay, thank you for listening. And next indicator is we are moving on to understand is women's work or economic participation, that I'll be taking in the next section. For now, thank you students.